Hello and welcome to episode 37 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is why it's not Piriformis syndrome. It's not Piriformis syndrome. Yes, your glute is painful. Yes, you might have symptoms traveling down your leg, but it's not Piriformis syndrome. And we're going to explain why. Last episode, episode 36, I discussed 3 top ways that you can begin to improve your recovery, not just specific to low back injuries. Of course, it is emphasized for low back injuries, but with any injury for that matter. And these suggestions that I make can really go a long way and are quite valuable. So if you're looking for ways right now that you can improve your well-being, improve your rate of recovery, improve your chances of recovery, go listen to episode 36. Now, today's all about Piriformis syndrome. This syndrome is thrown under the bus all of the time. Oh my gosh. Whenever I talk to anybody, it seems like it's 70% of people who have sciatica. They tell me, oh yeah, I was diagnosed with Piriformis syndrome. Guess how many of those ended up being Piriformis syndrome? So far, 0. I have seen 0 cases of Piriformis syndrome. 0. So first off, what is Piriformis syndrome? Well, clinically, Piriformis syndrome is described as a condition where the sciatic nerve pierces through the piriformis muscle. The piriformis muscle is a gluteal muscle. It's part of the gluteal group, kind of right in the center of your glute, which is why it's blamed all the time. The sciatic nerve pierces through it. And so it's termed that, that nerve is piercing through the piriformis muscle. The piriformis muscle is really tight and is compressing that nerve. And that's why you have pain in the glute or pain down the leg. Now, more recently, because it's so vague, they've actually started saying, it doesn't have to pierce it. It can just go next to it. So the sciatic nerve can go next to the piriformis. But if the piriformis is inflamed and irritated, it's going to compress the sciatic nerve. Okay, so let's start with the description of the diagnosis and explain why it makes no sense. Okay. If something can go nearby the muscle and you can blame that muscle entirely, then why aren't the other muscles in the glute blamed? Why is there a piriformis syndrome and not a superior gemellus syndrome, a inferior gemellus syndrome, an obturator internus syndrome? Like, there's multiple other muscles that are near the sciatic nerve. Why aren't they blamed? Why is it the piriformis? Because it's the biggest one. It's the biggest one and it's closest to the sciatic nerve. Okay. Let's take the same scenario. Let's say that same person with gluteal pain has sciatica going down the leg, and they also have sciatic nerve referral into the hamstring. And they're like, my hamstrings are so tight because of my sciatica. You don't have Piriformis syndrome. You have hamstring syndrome. Your hamstring muscles are so tight that they're compressing your sciatic nerve. Now it goes into my calf. Okay, it's not hamstring syndrome. It's calf syndrome. Your calf is tight and compressing your nerve, right? It's not, these don't exist. That's silly. So why do we call it Piriformis syndrome? It doesn't make any sense, okay? It doesn't make any sense. It's vague. It's inaccurate. The diagnosis definition has been shifting. It just doesn't make any sense, okay? Could the gluteal muscles, the deep gluteal muscles, the piriformis as well as the others, could they be involved with maybe the mobility of the nerve or the function of the hip that could affect the sciatic nerve? Sure. Not denying that. Could strengthening the piriformis or the other glute muscles potentially help? Sure. Could, mobilizing them or improving control of them help? Sure. But is it Piriformis syndrome? Is that the reason why you have sciatica or pain in your glute? I would argue 99% of the time, no. And the reason why is because every single person that I have met with that has been told that they have Piriformis syndrome, and we go through an assessment, every single one of them, we were able to immediately reduce their gluteal pain or their sciatica without doing anything to the glutes, without doing anything to the piriformis, without stretching the hips, without stretching the piriformis, nothing. We only did a low back movement or 2, perhaps. It just depends on what we find needs to be worked on, but we were only doing movements that moved the low back. And all of a sudden, oh my gosh, their glutes better and their hamstrings better. Is it piriformis syndrome then? Probably not, because we're doing nothing to the piriformis, but yet the piriformis feeling, the glute feeling, the hamstring feeling is improving. Therefore, it's not the source of the issue. The source of the issue is coming from the low back. Discs can refer down to the gluteal region. Sciatic nerve commonly refers to the gluteal region, to the hamstring, to the calf, to the foot, right? That's the path of the sciatic nerve. It's probably going to cause some irritation through that. It's not uncommon. But man, we got to stop blaming it on the piriformis syndrome. Just stretch it, right? There's some confusing direction out there. Like there's some articles that will say, here's how to diagnose your piriformis syndrome and whether you should stretch it or strengthen it. Get into a piriformis stretch or a figure 4 stretch, right? Like cross one leg over the other and see how far down your knee goes. If it doesn't reach 90 degrees, or if it doesn't go as far as the other leg, then it's tight and you need to stretch it. If it does go 90 degrees or as far as the other, it's loose and you need to strengthen it. I just talked in a very recent podcast, I believe it was episode 35. Let me check right now. 35. To stretch or to strengthen. Muscles aren't loose. Muscles aren't tight. Strengthening a muscle does not tighten a loose muscle. Stretching a muscle does not loosen a tight muscle. It doesn't work that way. It just doesn't work that way. It's not the way physiology works. If you're thinking right now, what? Go listen to that podcast and I'll explain why. It's not the way physiology works. So there's just so many buzzwords around piriformis syndrome. People are told they have it all the time. Do glute work, do piriformis work, stretch your piriformis, and they don't get better. They might get some temporary relief, right? Because when you're stretching the piriformis, you're also doing what? You're mobilizing the sciatic nerve. Do you think you're going to feel some relief with sciatica if you mobilize the sciatic nerve? Probably. But then you're going to go around saying, yeah, I got piriformis syndrome. When I do my piriformis stretches, it helps for a little bit, but it comes back. It's because you're mobilizing the sciatic nerve, not because you're stretching the piriformis and that is helping. The piriformis stretch is helping. It has nothing to do with the piriformis. It has to do with mobilizing the sciatic nerve. It has to do with movement. That's the key. But if you keep, living life thinking you got piriformis syndrome, you might continue just spinning your tires a little bit. And I don't want you to spin your tires. I want you to have an accurate assessment, an accurate plan, a specific plan, so you can get immediate results. So I just hear about piriformis syndrome all the time, and it's just very, very misdiagnosed. It's very overdiagnosed. It's vastly overdiagnosed because a lot of people just don't really know how to assess low backs properly. You've pain in your glute? Oh, piriformis syndrome. You've pain in your hamstring? Oh, tight hamstrings. You have pain in your calf? Oh, something's wrong with your calf. You strained your calf. Pain in your foot? Plantar fasciitis. All of those things I've had clients come to me for, and it ended up being from the low back. All of them. People diagnosed with plantar fasciitis for 3 years. Not getting better, coming from the low back. Yeah, I've had a calf strain. Oh, for how long? Over a year. I don't think a muscle is strained for over a year. I don't think that exists, coming from the low back. Oh yeah, I just got tight hamstrings, but one of them is way tighter than the other. Well, that doesn't make any sense. Yeah, I was told to just keep stretching it. Kind of makes it worse though, coming from the low back. Yeah, my glute hurts. It's the piriformis, so I just stretch it, but it keeps coming back. I strengthen it, it keeps coming back. It's probably not the piriformis. It's coming from the low back. All day long, every week, I have cases like this. Every single week. So I encourage you to forget about the piriformis. Once again, could strengthening that area, mobilizing that area, could that be beneficial? Mobilizing the hip and improving hip function as a whole? Sure, absolutely. I have all of my clients work on their hips, hip mobility, hip stability, all these things. I have every single one of my clients work on those. After we address the low back though, after we fix the low back and we vastly improve the sciatica, vastly improve the gluteal pain, then we work on those things. But it's not the source of the problem. So I don't want you to be confused. I don't want Piriformis syndrome to continue to be so popular, because it really shouldn't be. And it's causing more confusion than anything. It's probably causing more harm than good, to be honest. So I know why it's used so much, once again, just because people point to where it hurts and people say, oh, must be your piriformis, but it's just not really the way that it works, right? Not really the way that it works. We got to analyze the low back properly. We got to consider where it's coming from. And here's one final thing I want to leave you with, a test that you can try, okay? If your glute hurts and you've been told it's piriformis syndrome, I want you to sit down in a chair, okay? Sit in a chair. I want you to round forward like you're trying to tie your shoes. Bring your chin down to your chest. And then that same leg where the glute hurts, let's say it's your left glute, start to straighten that left leg. If you feel a significant increase in pain in that glute, but also maybe pain in the low back, also pain in the hamstring, also pain in the calf, that's not piriformis syndrome. That's coming from your low back. Okay, now, I don't want to be liable for any of you out there hurting yourselves, so I'm going to say a disclaimer. Only do that with professional guidance. All right. Just something to hypothetically try, right? Hypothetically. Theoretically, if you were to do that and it were to increase pain in those regions, it's probably not piriformis syndrome. It's a low back issue. It's a disc. It's a nerve root issue. One of those things. Very simple test. Try it right now. See what it does. Prove to yourself it's not piriformis syndrome. Let's put a plan together for you that is not focused on your piriformis syndrome. Let's put the right plan together. And if you've been continuing to spin your tires and not get anywhere, it's time to do something more serious about it. So let me know if you would like my help. You can submit an application using the link in my bio on Instagram, in the show notes, in the description on YouTube, or just simply go to my website and go to the application page so you and I can meet one-on-one and work together. As always, if you enjoyed this podcast, please leave a 5-star rating and review. Share with a friend. It helps boost the podcast and improve engagement and reach more people. Also, if you're watching on YouTube, please like, comment, and subscribe. If you know someone who is struggling with low back issues, please share this with them, or maybe a friend who's been told they have piriformis syndrome. Share this with them so they can get proper advice. And then finally, move more, move in nature, and move in the sun. Thank you so much for listening, and have a great day.